Hi everyone, I'm back again, and today is going to be about pain treatment lesson 9. You may ask, what is that all about? Don't be too curious. Let's go. Okay, it's about opioid called hydromorphone, or the trade name dilaudid, hydromorphone or dilaudid. Hydromorphone is a very strong analgesic and opioid. If you give it per aura, you're going to get less potency compared to 5 times the potency when it's given parenterally. In other words, if you compare giving about 2 milligram per aura to 2 milligram intravenously, you're going to get 5 times the potency through the intravenous route. So you give very low dosage when you are giving it parenterally compared to per aura. Doses could be variable depending on the formulation. For example, if you are using the tablets, you can give 2 to 4 milligrams every 4 to 6 hours. And I need to reiterate that this is about immediate release forms. Okay, if you are giving the liquid form, you can give 2.6 milligram or 1.5 milligram every 3 to 6 hours. If it is through intravenous route, you can give 0.2 to 1 milligram every 2 to 3 hours. Also, it's possible if you want to infuse, you can use 0.5 milligram to 1 milligram per hour infusion. IM, that is intramuscular or subcutaneous use, could be used, but do that with care. Intramuscular use is not good because it causes pain. If you want to give it subcutaneously, you can use 0.167 to 4 milligram per hour continuous infusion. When you want to use it for patient control analgesia, PCA, though I have made a separate presentation on PCA, kindly check my channel for that. The loading dose will be 0.4 milligram and could be within the range of 0.1 to 0.4 milligram. The lockout interval is 10 minutes. If you are using epidural route, the patient control analgesia bolus 0.4 to 1 milligram will be fine. If you want to infuse through epidural route, 0.03 to 0.3 milligram per hour infusion is appropriate. The demand dose will be 0.02 to 0.05 milligram, and the lockout interval is 10 to 15 minutes. If you are using the control release capsule, you can use that, for example, Hydromorph-contin for opioid tolerant individuals. You can use as high as 12 milligram to 18 milligram daily. Okay, but for opioid naive, you use 3 milligram every 12 hours. The extended release tabs like Exalgo for opioid tolerant only, and the dose is variable. Okay, hydromorphone could be given rectally, that is suppository, at a rate of 3 milligram at bedtime or every 8 hours. However, if the affected individual that will use this medication is having renal problem like renal failure, you don't need to adjust the dosage of the rectal suppository. But if you are using other forms of hydromorphone, intravenous, per oral tablet, liquid, or you using subcutaneous route, epidural, and so on, you have to adjust the dose based on the renal glomerular filtration rates. When you want to discontinue hydromorphone, please don't stop suddenly. It should be done gradually or you'll be tapering off very slowly. In pediatrics, you can give 0.03 milligram per kilogram per dose every 4 hours when required, or PRN. That is, if you are giving it per oral or immediate release form. Intravenous route, we are trying 0.01 milligram per dose every 3 to 6 hours, or 0.03 to 0.005 milligram per kilogram per hour continuous infusion. Advantages of IV hydromorphone is you require less amount of the medication. Remember, I've said earlier that you're going to get 5 times the potency when you use it parenterally compared to per oral, and no hepatic cytochrome P450 metabolism. Therefore, less reduction in effect when it's used with enzyme inducers. The advantages, however, is there will be neurotoxicity because certain metabolites may accumulate in hepatic or renal failure. Okay, so if the patient is having liver failure or renal failure and you are giving hydromorphone, you are likely going to have neurotoxicity. So you adjust the dose in hepatic failure or renal failure. And with that, I've come to the end of this very presentation. We have more to talk about when it comes to pain management. Kindly subscribe to my channel so that you can get my presentations immediately they are published. Thank you.